Greetings, fellow citizens of Shelby County. I'm Dr. Bruce Randolph, the Health Officer for Shelby County Health Department. I'd like to just provide with you today information on our data, update as of 3/15/2021. Our total cases to date is 89,681. Of those, we experienced over the past 24 hours 84 new cases. Our active cases are 1,052, which represents 1.2%. If you've been keeping track, our numbers of active cases have been steadily declining. Our total deaths as of yesterday was 1,539, which represents a death rate of 1.7%. At this point, we have performed over 1 million tests. Matter of fact, it's 1,059,119. Of those tests, 10%, which is 102,349, have tested positive. However, our 7-day positivity rate, the percent of tests that have tested positive over the past 7 days, is down to 3.3%. When we look at our cases demographically in terms of age, we still see that 62% of all the cases are occurring among individuals ages 18 to 54, in which 35% occur between ages 25 to 44. Of course, still 56% of the cases occur among blacks, 31% whites, 12% Hispanics. When we look at our death data, we find that 90% of the deaths occur between ages 55 to 85 and older. And we see that most of these deaths occur between ages 65 and 85 older. 58% of those are among blacks, African Americans, and 36% white. Of course, comorbidities are different, certainly an issue. Most of the deaths that occurred with associated comorbidities was involving cardiac, 53%, respiratory disease or illness, 47%, diabetes, 29%, obesity, 15%. And I just highlight that is because you can now better understand why the phases and priorities are. And certainly, Chief McGowen will give more information about the vaccines and can break down the information and demographics accordingly. I just also want to bring to your attention that effective tomorrow, March 17th, we will be issuing a new face mask directive, number 5, and we'll also issue a health order and directive number 19. The face mask directive will become effective tomorrow, March 17th, 2021, and the health directive will become effective March 20th, 2021. Just to highlight some of the major changes, the face mask directive, the major change there is that people who are not able to medically tolerate a face mask are exempt from wearing one. They would not be required to provide medical documentation to prove that they cannot tolerate a face mask. Also, in the health directive, we make some reference to gyms, and we're recommending that individuals follow the guidance of the CDC and the Tennessee Pledge as it pertains to exercise facilities and gyms. I want everyone to understand that the face mask directive requires everyone to wear a mask when in public and when going into businesses and establishments, but there are exemptions that's listed in the directive. Even going into a gym, the expectation is that you are to wear a mask while you're there in the gym and while you're exercising. But if for medical reasons you are not able to, then you should have a conversation with your physician, talk to them about it. And we encourage you, per CDC recommendations, to exercise ideally outside, to certainly try to distance and work in areas, exercise in areas that's highly ventilated. The other significant change with the health directive is pertaining to restaurants. We're allowing restaurants now to extend their hours to 1 a.m. If someone is in the restaurant at 1 a.m. and have not finished their meal, they are allowed to remain finishing their meal until 1:30 a.m. We're also allowing up to 8 people of the same family unit, close contact unit, to be seated together. Individuals may sit at the bar, but still only 2, and those 2 must be separated 6 feet away. Everyone is still required to wear a mask unless they're actively seated and actively dining. Those are the primary changes. Still, we expect people to maintain 6 feet separation. And I just want to really ask everyone, let's continue the course that we're on. Things are still trending downward. We're making great progress with vaccination. Let's continue to wear our masks, maintain 6 feet separation, so that we can even do more than what we're currently doing. It is very important that we do that. There's been some talk about the risk of an outbreak of the variant. That possibility is real. But if we continue to hold to what we're doing, we continue to practice the preventive measures that's incorporated in the health directive, we can prevent the transmission of this virus. And so we encourage you, remain steadfast, hold the course, and let's continue to get back to some sense of normalcy. With that, I'm going to stop and invite Chief McGowen to the podium.
Thank you, Dr. Randolph. Doug McGowen with the Joint Task Force in the City of Memphis. I'll just give a brief update on the vaccination program, and then I'll turn it over to Fire Director Gina Sweat, who wants to talk a little bit about the phase that we're in comorbidities. So I'm pleased to report that today we've administered more than 225,000 vaccinations in Shelby County, and that's Shelby Countyans receiving those vaccines. Last week, between the fixed site pods that are open to the public and our hospital systems, we put more than 37,000 shots into arms. This week, just at our public pods and our pop-up pods that we have around the community, there are 39,000 opportunities for people to take advantage of vaccines, in addition to the several thousand that our hospital systems have, in addition to about 14,000 that starting today, some of the community partners I mentioned to you on Friday will be able to begin administering, and that's through community clinics, doctors' offices, and some of the dialysis centers and those things. You all know that we did shift briefly last week to a new appointment system called VRAS. That happened on Friday. Less than 24 hours later, we shifted back to Sign Up Genius. Nobody was denied the opportunity to get an appointment because of that. We identified some problems and quickly decided to go back to the system that had allowed us to have some success to this point. We have shifted to a new call center that has more than 750 agents. That call center is open 7 days a week, but the hours are 9 in the morning until 6:30 p.m. at night. And so if you call before those hours, you'll likely be on hold. If you call after those hours, you'll likely be on hold. And so we are working with that call center to make sure that everybody has a chance to get an appointment. As far as scheduling, we started the teacher vaccinations about 3 weeks ago, and so this week and next week we will largely finish all of our teachers in Shelby County. The very last week of the month we'll catch up with some of the last teachers from Shelby County schools, and so we're looking forward to have all of our teachers fully vaccinated. As early as tomorrow, we will begin our homeless and homebound vaccination program. We just recently received a small amount of Johnson & Johnson vaccine, which is much more easily transportable, and we'll be using that for our homeless and homebound populations. We did talk about monitoring the data, and so I'll talk just a little bit about vaccine data. I mentioned to you that we're looking at zip codes where the uptake is the lowest in the county, and then responding with pop-up pods in those areas to make sure that we can get vaccine to people who need them. 38127 in the Fraser area was one of those zip codes. So this past weekend, we had a pop-up pod at the Memphis Fire Academy where we delivered more than 2,000 vaccinations. We will hold another one there this coming weekend so that we can deliver even more vaccinations to the 38127. In the 38115, 38118, and 38141 Hickory Hill and Parkway Village area, we held a pop-up this weekend at Greater Community Temple where we delivered just about 700 vaccinations. That was after about 600 vaccinations the weekend before that we had done with Anointed Temple of Praise. This coming weekend, we had a pop-up pod with World Overcomers set for tomorrow, but because weather is rolling in, we have decided to move that to Saturday. That will be delivered at the Old Hickory Ridge Mall, the World Overcomers Church, where we'll do between 500 and 1,000 vaccines. So we are targeting vaccines to the zip codes where folks need to have greater access, and we're going to continue that each and every week as we identify new partners to deliver pods. Also, we're paying attention to the demographics. We had talked about the racial disparity in uptake of vaccines, and when we began this at the end of phase 1A1, it was under 20% African Americans as the whole of the pie of people who had received the vaccines. Well, today, through our efforts, we're up to more than 31%. So I mentioned last week we had just reached 30%. Today we're at 31%. We're continuing to climb. We will not stop until we reach the appropriate level of demographics for the makeup of Shelby County. As you know, more than 55% of Shelby County is African Americans, and that's the mix that we would like to get to, is the same proportion as our population. So we have more work to do in our efforts to make sure that we can reach people no matter where they live. If they are experiencing temporary homelessness, whether they are homebound, it doesn't matter where you live, we want to make sure that there's a vaccine available to you. Last thing I'll cover before I turn it over to Chief Sweat is the weather. As you all know, during the ice storm we had to suspend vaccinations, and I'm telling you now that tomorrow our public pods will not be open for vaccinations. There is a severe weather line coming in. I know today it's absolutely gorgeous outside, but the National Weather Service has increased its level of risk for tomorrow. It was already going to be severe. Tomorrow we'll have even more severe weather coming in. And so given the nature of the outdoor and the drive-through and some of the tent facilities we have, the likelihood of hail, lightning, thunderstorms, and even some tornado warnings in the area, we will not do vaccination appointments tomorrow. Anyone who has an appointment at our public vaccination sites will receive an email from us and will be given the opportunity to reschedule on Thursday, Friday, or Saturday of this week. We have lots of appointments still open. And for anyone who is unable to avail themselves of that appointment this week, you will be given the first opportunity to schedule an appointment next week before everyone else, before the appointments are open to everyone else. So we apologize for the inconvenience for people who are scheduled to be vaccinated tomorrow. We want everyone to be safe, not just our workers, but anybody who happened to be out in the elements. So out of an abundance of caution, we will suspend operations tomorrow and then pick them right back up on Thursday, Friday, and Saturday. So now I'm going to turn it over to Director Sweat, and she would like to talk to you a bit about who's eligible and the urgency of people receiving vaccines.
So I just wanted to cover a little bit. What we've noticed is some people may just not realize that they are actually currently available within phase for a vaccine. So the age range is 65 or over, and that's pretty easy. Most people know how old they are. But the comorbidities, I wanted to dive into that a little bit more so that people exactly understood what that meant. So what that means is people who are over 18 and have a medical condition that has the potential to make COVID-19 infection get worse faster are now eligible to get vaccinated. Now, some examples of this include, but are not limited to these, high blood pressure, diabetes, if you're on dialysis, if you have asthma, if you're pregnant, and if you're overweight with a body mass index of greater than 30. So just for an example, I know none of us really want to admit that we're overweight, but a person that's 5'9" who weighs more than 203 pounds should now be eligible for a vaccine. Your BMI is likely over 30. So that just gives you an idea. We are going to be posting something on our website that lets you plug your information in and calculate really quick what your BMI is. So that'll be on the COVID-19.memphistn.gov site. Just so you'll know, you'll be able to go on there. If you meet any of these criteria, you are now eligible for a vaccine. Please either call or go to our website and set up an appointment. Some other conditions that you may not be aware of that qualify you for a vaccine immediately: sickle cell disease, stroke, heart failure, coronary artery disease, COPD, pulmonary fibrosis, immunocompromising conditions that require medications, dementia, or liver disease. So we're just asking that please, if you're over 18 and have any of these medical conditions, you're now eligible, and it would be very important for you to get the vaccine now, so we'd like for you to make an appointment. Also, one of the issues we've noticed, we've really worked hard on the scheduler and to make appointments available for everyone who meets the criteria. So if you go in, we're asking you not to make multiple appointments at different locations, because really what that does is that someone else, if you take up that spot and you don't show up, that's a vaccine that somebody else may have been able to get that day. So if you're going to make an appointment, we have worked really hard to get our wait times down at all of the centers. I believe last week it was under 15 minutes at every one of our mass vaccine locations. So the wait time should not be an issue. So you don't really have to shop for a better location to get a vaccine. So just sign up at one location. If for some reason you can't make that appointment, just please go in and cancel. You can contact the COVID-19 help at memphistn.gov and just send us a notification if you have trouble canceling your appointment. So with that, I'd just like to go ahead and open it up from questions from the media.
Brad Broders, Local 24.
Thanks. Good afternoon, everyone. My first question is for Doug. Doug, I know you talked about the homebound and homeless efforts beginning tomorrow. Could you give a little more details about how many doses weekly you might expect, how staff will be able to get to these individuals, just a little more detail on that?
Sure. So, well, there's a number of ways, Brad. That's a really good question. So one of the providers, there's several private providers that do homebound work, and they're actually in the field and doing that today. So I don't want to make it sound as if we're the only ones doing that, because this is work that people in private enterprise do also. There are medical doctors who do this. And there's actually a story that was out about one of our wonderful doctors here in Memphis and Shelby County who's already engaged in that work. But we have a program through Memphis Fire, our Healthcare Navigators program, and their job really is to work with a homebound to make sure that they have access to the health care that they need. We have assembled a list also through several of our partners. The Community Alliance for the Homeless would help us with the homeless population, the Aging Commission, MIFA, through Meals on Wheels. We're able to identify people who are homebound. We've assembled a list of several hundred individuals who are in the most urgent need, who have very limited transportation options. And then our healthcare navigators, who are all trained paramedics, will visit these individuals with a vaccine to make sure that they're inoculated. They'll also take care of any other healthcare needs that they have while they are there. The number of doses that we have received our first allocation of J&J from the state. That allocation is in the hundreds, so the maximum we will receive is 500 this week. That's what we will begin doing this work with. You all, I know by now, understand that Pfizer and Moderna are a little harder to work with in the field because of the refrigeration and freezing and the time that you have to work with the vaccine. The J&J is much more stable and much more transportable. So We have 500 this week. We have heard from the state that there is none coming next week or the week after until they get another federal allocation. We have asked, we would like to be at the top of the list when the state gets those vaccines in, but we believe that that's a good regular rotation of several hundred per week to reach those homebound individuals. And then we're working with the Shelby County Office of Community Services and some of our homeless partners, the Community Alliance for the Homeless, the Hospitality Hub, to organize events where we can go and meet people who are experiencing homelessness so that they can also have access to a vaccine.
Thanks, Doug. And as a follow-up, I know you had talked about Wednesday really honing in on those 10 zip codes that are underserved. Beyond, I know you're doing Hickory Hill and also Fraser again this weekend. Any other zip codes that might be sort of next in line for people in specific areas that you hope to put pop-ups soon?
Sure, that's a great question. So 38106 in the South Memphis area and 38114 in the Orange Mound area, we're already working on plans with partners there to begin delivering a pop-up site in those areas because we know that there's a low uptake in those neighborhoods. So we absolutely, the data will change perhaps a little every week. It was stable last week to this week, so that means we have more work to do. So those are the next two zip codes in those areas where we will be putting up pop-up pods.
Hannah Grabenstein, MLK 50.
Hi, I'm looking at the text of the face mask order under directive number 4, and it already has exemptions for people who cannot medically tolerate wearing a face covering. And I'm just wondering, what will the difference be between the directive number 4 and directive number 5?
I'll let Dr. Randolph answer that question.
Yes, in directive number 4, it says that if you cannot wear a mask for medical reasons, that you need to wear at least a face shield. That was primarily directed at those who were going to gyms and pretty much alleging that they could not wear a face mask. And our position was, okay, if you can't wear a face mask, you need to at least have a face shield on. But in further reevaluation of that and CDC guidance, it pretty much states that a face shield is not an adequate substitution for a face mask. We decided to remove that particular requirement.
Okay, thanks so much. And then another question, just a quick follow-up. You guys have been getting the messaging out a lot about people with comorbidities, really stressing that if you're eligible, now is a good time to sign up. And I looked through a lot of the availabilities for this week, and it looks like there's like dozens, if not hundreds of appointments still available, even taking into account that Wednesday you won't be doing any vaccinations for weather. I'm just wondering if there's so much availability, wouldn't it make sense to just open it up to the general population at this point? Certainly,
that is something that we're looking into. I mean, we do not want the risk of vaccine going to waste or not being used because people who are in a given phase are not signing up. And so certainly I'm an advocate of whosoever will let them come and receive the vaccine. I'm also in agreement with President Biden's goal of ensuring that sometime in May, folk 18 years or older who want the vaccine can have access. So we're looking at ways to move people into other phases. For example, grocery store workers and other people who are way down in phase 3 should be moved up, in my opinion, especially in light of the fact that we are soon approaching a situation where we may have more vaccine than people signing up. So we want to vaccinate as many people as we can, as soon as we can, and so we are exploring ways to achieve that goal. I don't know if Chief McGowen want to add.
I'll just add that, we have to stay in rhythm with the state of Tennessee. The entire state is at Phase 1C, age 65 and up. The dialogue with the Unified Command and the governor is whether or if we are ready to make a pivot across the state to the next phase. And I expect to hear something on that this week. They have lots of medical professionals who are making that advice. They're looking at the uptake across the state. There are places in the state where they are not seeing the same trajectory with open appointments that we are. They are as soon as they open an appointment, it's filled. That's where we have been. Our efforts right now will be to make sure we get the word out. You all can help us do that. I think the word comorbidities kind of may confuse the issue. If you have an underlying health condition that you or a family member has, just encourage people to talk about that and say, I think you're eligible. Why don't you want to get a vaccine? Because very likely you are eligible. So, but yes, more to come on that as we continue the dialogue with the state.
Catherine Burgess, Commercial Appeal.
Hi, kind of on that note, what sort of educational campaigns are you planning to have to target people who remain on the fence about getting the vaccine?
It's a great question, Catherine, and that is what our communications team is doing. We have received some assistance from Blue Cross Blue Shield. We have several philanthropic partners who are also assisting us with communications. We have a campaign called It's Your Best Shot, or It's Our Best Shot, that we're rolling out to let people know that vaccination really is our best shot to get returned to normal and go about the business that we have been used to and accustomed to here. So, but there are very specific and targeted messages for individuals who are on the fence. I mentioned before, it's not just about the message sometimes, it's about the messenger. And it's easy for folks to look and see me on this press briefing and encouraging people, but if they don't know me, there's probably someone who lives near them or is a trusted agent that they do know that can give that message more ably to convince person to go get that vaccine. So I think it's everything from boots on the ground, grassroots campaign from people in the neighborhoods who are influencers and people trust to get that message out, to a more broad-ranging campaign, and we are working on every front to try to break down those barriers. One thing we did talk about is the men. We're still only about 30% of the vaccine uptake is from men, but 60+% is from the women, so we need to do some more work with men to say this is about protecting you and protecting your family. So we have some messaging as well for men that's coming.
Do you have any theories as to why men aren't getting the vaccine?
I'm not an expert in that area. I don't really have any theories, but all I can say is that we should step up as men. We have a responsibility to ourselves and to our families to protect ourselves. You're not any good to your family if you're sick and in the hospital. You're not any good to your family if you're dead. So please get the vaccine so you can continue being a great role model for your family. You can be a great part of the family that you are lucky enough to have.
Jane Roberts, Daily Memphian.
Doug, did you say that you hope to hear this week from the state about the possibility that we might be opening up the vaccine phases? And when do you think that could happen?
Sure. I'll hear from the state this week. I don't mean to project that they will decide this week. We're in a regular dialogue with the state, and I do know this is on the agenda of things that they're talking about. Whether or if they are ready to make that move this week is a different story, Jane. So I just know that that's on their agenda of things that they are talking about. So we do a routine check-in about 3 times a week with the state. So this afternoon at 4:30 or Friday afternoon at 4:30, we may hear something more. We may hear that we're staying in this phase for another week or two, but as soon as we know that, I'll let you know.
Thank you.
Greg Akers, Memphis Business Journal.
Hi. As regulations are loosening and more people are getting vaccinated, people may be feeling more comfortable in going out and congregating. What are you looking for in terms of potential red flags that might show in the data that would concern you of increased community spread?
I'll let Dr. Randolph speak to that, but from the task force view, clearly anything that is a leveling off, a dramatic leveling off of the number of cases that we have, a slight uptick in the positivity rate, and then also we're paying very close attention to our hospitalization rate. That number has been coming down. Today, we're at just about 150 hospitalizations, which is down dramatically. But at the end of the day, any increase in hospitalizations is a signal. Any flattening that where we don't see continued decrease. And then you've heard a bit of conversation about the sequencing. And we've been very successful in this community with the number of tests that we do, doing sequencing to make sure that we're identifying those variants which are much more transmissible. So in other words, you get one of these variants and you have to very quickly isolate the individuals and contact trace all of their contacts so that you do not have this highly transmissible virus moving across the population. When I start seeing a significant uptick in the number of variants, that is cause for concern. So we are not out of the woods. I think Randolph will tell you that. The numbers are encouraging, but the only reason they're encouraging is because we're doing the right things. We're getting vaccinated. People are still wearing their masks. They're not letting their guards down. That's going to be particularly important through this coming holiday weekend over the Easter and MLK Day. So I know folks are going to want to gather, but the same rules apply. Please use common sense. Please don't let your guard down, and then we'll be on a better track for the fall. Dr. Randolph, anything to add to that? Okay. Greg, anything else?
Yeah, well, just as a follow-up, have you targeted any benchmarks that if those were surpassed, could potentially trigger new restrictions or going back to some of the same restrictions we've had?
Sure. We would generally use the same milestones that we had on the way back up. As you know, we've done this at least twice now. And so we have some of those triggers in place. We will talk as a task force as to whether we need to tighten some of those down based on the variants. I can't give you the number, chapter and verse today standing here, but we are in dialogue with the infectious disease docs about what happens if we do see these variants, and does that change our triggers?
We are out of time. Are there any closing messages today?
So, Gina, anything you'd like to close with? Dr. Randolph, anything? Okay, Dr. Randolph will close us out.
Sort of want to just echo what Chief McGowen has said about the importance of still remaining on course, wearing your mask, maintaining social distancing. Yes, we will be monitoring the case numbers, making sure that we don't have an outbreak of the variant, and also we will continue to enforce the health directive. And so we encourage everyone to continue to do your part. It is now time that we move from more of a big brother perspective and it become more a individual responsibility to make sure that you, your loved ones, your family members, and community remain healthy and safe. Have a good afternoon. Thank you.
Thanks, everyone. We'll see you back here on Thursday.